I'm Dr. Engin Sezer from Turkey. Actually, my interest in dermatology is dermatopathology, which I studied abroad in UK and USA. But you know, as a dermatologist, we have to treat some skin disorders as well, and we also do some rejuvenation or other treatments. And by the way, I'm grateful to Dr. Stefan Schulze for his kind invitation for this lovely Congress and to Paris, and it was an honor this morning to meet with Dr. Manstein and to know him personally. So there are some conditions that we have to treat, like the active acne, like the acne scars, like the melasmas or the rosacea. The topical or the systemic treatments do not work every time. So this is why, as a dermatologist, we have to use these lasers for medical issues and for also for aesthetical issues as well. So the advantage of 577 is that you can feel that, so it's just for 1 year that I start studying with the device, having my clinical patients. And I feel myself very safe because you know that you can see some tiny black dots like crustings, but you will know that they will peel off over time, and the percentage of developing these crusts are maybe 5% to 10%, and the erythema, the redness disappears over 1 day time, and there is no bruising, and I treated maybe more than 300 cases without a single case of post-inflammatory hyperpigmentation or post-inflammatory hyper or hypopigmentation or any scarring. So that's important, even in higher skinned individuals like Fitzpatrick phenotype 4. So this is the procedure using the handpiece, and I will show the scanner mode as well. The point is that with this device, we do not use a plate, because if we use a plate, then we will make a pressure on the skin, as how Professor Manstein mentions. So we can make these blood vessels constrict. So the chromophore will get affected, and so we will have a lesser clinical outcome. So this is one of my case of larger vessels on the nose, thicker than 300 nanometers. And just even after the treatment, you can see how we get a nice results after. And this treatment may be repeated as well. So no risk of hyperpigmentation, no risk of hypopigmentation. When we use the handpiece, it's just a 1 millimeter spot size. So we just simply foul off the vessel, and there's almost no pain. Yes, I know. With the scanner, I do not personally use the cooling air or any cooling device. So just to make the procedure more comfortable, I use the anesthetic cream. Plus, I'm going to show the video at the end of the session. I also use this vibrating tool together. So this is another case, and we can see that, yes, the dilated vessels on the sides of the nose almost disappears in a very nice way. So actually, this is a case of mine. The patient is a doctor as well, a physician. And she was treated with an Nd:YAG laser, 1064 nanometers, and you can see that scarring there and the persistent telangiectasias. So, sorry, I think there's some technical. I think so. Whatever. So we can see that. We can treat these dilated telangiectasias efficiently without causing any scarring. Yes, the scar was related to a previous application of Nd:YAG laser.
I just want to clarify, the white spot you see in the right half, that...
I think here.
Yes, this was by an Nd:YAG laser treatment prior with another device.
And this is after immediately after clinical picture. And we can see this, the clinical outcome of the vessels. So how do we treat the lesions with 577 nanometer laser? We can either use 30% or 40% coverage without cooling and using only a thin layer of ultrasound gel. Or either we can use a cooling, which I do not prefer personally actually, and we can increase the coverage up to 80%. And here's the clinical outcome of a patient of mine, and she was very unhappy because of this diffuse, very severe erythemotelangiectatic rosacea. And you see, after one session, the scores are decreased, and after two sessions, we can see the clinical results well. So this is an interesting case, and maybe we can publish this phenomenon. Because the lady had erythemotelangiectatic rosacea with grade 2 rosacea as well, because the lesions also showed some papillary components. And also, the patient also had some senile comedones on the malar region. And so I didn't treat the patient for these senile comedones, but I just started the treatments for the rosacea, and what I see is that the senile comedones almost completely resolved after the treatment. And we can see the clinical improvements of the telangiectatic and grade 2 rosacea. So this is a patient of mine, another patient of mine, and the patient was previously treated with different medications. This is a grade 2 rosacea, and the dermoscopy highlighted many these Demodex follicular mites and the oral antibiotics or topical pimecrolimus was not effective for the patient. So there are publications about the efficacy of the 577 laser on erythemotelangiectatic rosacea as well as the grade 2 inflammatory rosacea. So I started the treatment, and after 3 sessions, we can see the marked improvements, near complete resolution of the lesions. And there's also one paper about the efficacy of 577 laser on the treatment of Demodex follicular mites. And with that paper, the authors highlighted more than 50% of decrease of the Demodex population. So this is a clinical results of a friend of mine from India. The settings are around 18 joules per centimeter square, but I mostly prefer 22 joules per centimeter square. I use 7 millimeter times 7 millimeter scanner size with 30% density or 40% density. And the treatment is completed for the face around 20 minutes to 25 minutes. So here is the clinical result after the treatment sessions. And sometimes the rosacea can be induced by topical or systemic corticosteroids. And here is a case who responded after the 577 FlexSys laser. The advantage is that it's a fractional treatment, so we do not treat all the areas, but we treat a small proportion of areas, like 30% or 40%. So this way, I feel myself very safe, and I know that there's not going to be a risk of hyperpigmentation or hypopigmentation. I think there's going to be a pause or coffee break. Then we will keep continuing. Question, please.
Thank you, Doctor.
My pleasure.
I have 3 questions. I have a yellow laser, other brand. I ask you, is there any facial edema after the
facial
session?
edema,
Because
very
I
slight,
noticed
actually.
it's up.
You can see some facial edema, but it's never prominent. It's very slight.
Yes.
And it resolves over 1 or 2 days. And compared with other sort of vascular lasers, like the pulse dye lasers, you do not see the bruising, almost never. You can see these tiny black crustings, but this will peel off over time without any pigmentary disorder.
Another question about the telangiectasia in the nose.
Yes.
Can I use the scanner mode rather than the
No,
single pulse node?
Actually, in my first applications, I used the scanner mode, but it doesn't work. Because the lesions, the telangiectasias on the sides of the nose are mostly thicker than 300 nanometers. So what I use is that, maybe you can see on the device that you can change the scanner with the handpiece, which is a 1 millimeter applicator, and you will get excellent results.
From my experience in my device, it's more liable for post-inflammatory hyperpigmentation and scar formation if you use the single pulse mode.
Yes, but...
because you cannot predict the exact power that you stop working.
Yes, but
on
maybe
the device.
It changes on the device.
You cannot
or the
predict
specs of-
the exact power to stop. So it is. I saw that when I work with the scanner mode is better without side effect.
Of course, the scanner mode is somehow more maybe
More safer.
safe. But on the other side, personally, I didn't see a case of hypo or hyperpigmentation.
Okay.
The second advantage of the FlexSys is that you do not cool. But actually, I just forgot to show my video. If you use the cooler, then you will disappear the chromophore. Then the blood vessels will get constricted, and the oxyhemoglobin will get lesser. So you shouldn't do that, actually, theoretically.
Yes, sir.
And this is the only device, actually, with 570, as far as I understand, which doesn't cool and which doesn't have the plates. Because if you use the plates, then you will make some vasoconstriction. If you use the cooling or integrated cooling, then you will constrict the blood vessels.
So, ladies and gentlemen, let's go to the next part. And I told you this is very interesting and exciting, so we will not lose any time. You see, he's getting ready for the really hot results that he's going to present. And so now the next topic is to combine 1550 and yellow laser, and you will see what's possible with that. So, up to you.
Thanks so much, Stefan. So this is the power of 1550, actually, because, you know, the fractional lasers are either ablative or non-ablative. With the ablative lasers, like the CO2 or erbium YAG, you have to make some tiny holes, but this will disrupt somehow the melanocytes, and you can see the post-inflammatory hyperpigmentation. But using the 1550, you can also see some hyperpigmentation, but the ratio is very low, and the downtime is much more lower. So there is no extended downtime. There are some publications about the acne scars and post-acne erythema about 577 laser. Here is the result of a patient of mine. So since we can use 1550 nanometer laser and we can use 577 nanometer laser for the atrophic acne scars, what I do is that I combine the treatments. And here are the results. So hopefully this one works. Unfortunately, yes, okay. So this gentleman has some ice pick scars, and he has these dilated sebaceous pores. And this is before the treatment, and after the treatment, we can see that the improvements of the ice pick scars, and we can also see the improvement of the sebaceous. gland, the sebaceous pores, sebaceous pores. And we can see this rejuvenation of the wrinkles around the eyes as well. So there are publications about 577 and 1550 nanometers that we can use these treatments for the wrinkles as well, and improvement of the skin texture. So here is the result of a patient of mine for the atrophic acne scars. And you know, if the acne scars are very deep, like the rolling scars is in this case, or if it is ice pick scar, then we have to treat more aggressively. Actually, previously I studied with a fractional CO2 laser, FDA approved, and FDA approved radiofrequency microneedling. But actually, the combination results are much better with 577 and 1550 nanometer. And here is the atrophic acne scars of the rolling scar, and we can see the achievements after 2 sessions of 577 and 1550 nanometer. So we can also use the combination treatments for the acne vulgaris. And this is a very nice paper indicating that the authors achieved a very nice results after 1550 nanometer laser. And they just showed that the sebaceous glands are decreased in size. After approval of the patients, they just take a biopsy before and after 1 year, and they just realized that the sebaceous glands are decreased in size. So that's how we can achieve a good result for the acne vulgaris. So just I want to highlight that how we get the results for the sebaceous pores on this region, and before treatment and after 1 treatment. So this is the power of 1550 nanometer laser. Then I will show the videos as well. This is a case of mine for active acne. And you know, some of the patients do not want to use isotretinoin because of the systemic side effects. And these are the results of the combined treatment with 577 and 1550 nanometers. Before, we can see these marked inflammatory lesions, and this is the after laser result. And this is another case with prominent inflammatory lesions around the cheek, and we can see the improvements after the treatment session. And this is another case. We can both see the improvements of the acne scars, and we can also see the improvements of the active acne. So if you want to get some results for both inflammatory acne as well as the atrophic acne scars, we can combine these 2 treatments. The 1550 nanometer will help shrink the sebaceous glands, which was proven in the paper, and which we can see now. And 577 nanometer will help constriction of the blood vessels and decrease the inflammation. And we can also use for the post-acne erythema as well. So how about scars? So in the scars, if we take a biopsy from a scar, we will see the disorganized collagen fibers together with dilated blood vessels. So what we have to do is that we have to constrict the blood vessels, and we have to reorganize the collagen bundle. So that's why there are some papers, but they are mostly about combination of the pulse dye and 1550 nanometer. But what we do is that I combine 577 nanometer laser because you can well appreciate this telangiectatic appearance, the red appearance. If you look with the dermoscope, then you will see the blood vessels get dilated. And here is the results after 3 sessions of 577 and 1550. So that's the power of the combination therapy. And there are also papers about 1550 nanometer lasers on the improvement of wrinkles and skin texture. And here's a patient of mine. She had both rosacea as well as the wrinkles, and we can see the decreased wrinkles as well as improvement of the rosacea. For the melasma, there are papers about 577 and there are papers about 1550. So why don't we use the combination therapy for the persistent melasma cases? Because we know that if you take a biopsy from a patient of melasma, we can see these dilated blood vessels. And this vascular endothelial growth factor influences the persistent melasma. So what we do with 577 is that we constrict the blood vessels, and using 1550 nanometer laser, we help these melanin pigments to extract from the epidermis. And here is the results of treatment with 577 and 1550 nanometers. And you can see the melasma scores are decreased, and you can see how these pores, dilated pores, are decreased in size. And you can also see the improvement of these fine wrinkles around the eyes as well. So the combination therapy works for melasma, works for dilated sebaceous pore, works for atrophic acne scarring, inflammatory acne, and of course for rejuvenation, especially around the eyes or around the mouth. So how about the difficult to treat patients? I'm going to show some examples or some different tough cases. So you know that we get good result with excimer lights, monochromatic excimer lights, 308 nanometer, and we can just simply add the device and we can apply 308 nanometer excimer light treatments. So this was a case in whom we got good result on the face, but on the groin, there were persistent lesions. So this was located on the right groin area, and the lesion was located on the left groin area. And also, I performed the PRP treatments as well, because it's well documented that platelet-rich plasma injections also work by the growth factors as well. And the patient is on excimer phototherapy. But what I do on the right side is that I performed a 1550 nanometer laser after the informed consent, because there are publications about the use of fractional carbon dioxide laser in addition to excimer phototherapy. And by this way, this is the first time actually, this has never been published, but probably will get published, that combining the 1550 nanometer laser together with the excimer lights can enhance the clinical efficacy. You know, on the left side is still persistent, a little bit slight development, but here a prominent clinical outcome with the combine. So we can further combine the 1550 nanometer laser. So how does it work? According to the literature, it's also used for the androgenetic alopecia, and I will show my results as well. Microthermal zones induces WNT signals, and these signals help to restore the root stem cells. And by this way, the melanocytes proliferate, and we can have some additional benefits using the combination therapy. So this is not a vitiligo actually. This is a tough case, difficult case, but I didn't take a biopsy because it was a clear-cut diagnosis. I just looked with a Woods lamp exam, and it wasn't a vitiligo, but it was a polyosis-like alopecia areata. By dermoscopically, there were these vellus-like shafts, and there was loss of pigmentation. And the patient was persistent to systemic and intralesional corticosteroid treatments. And we know that there are publications about the efficacy of 1550 nanometer and also excimer light treatments for persistent alopecia areata. So we started treatments, and after a couple of sessions, you can see the good clinical outcome. And the patient and the treatment is going on, by the way. So for the androgenetic alopecia, if you have the power of 1550, I use almost to every patient of mine. even I use the minoxidil, even I use the PRP or the other treatments, because there are many publications about 1515. In this case, I just wanted to highlight that we can get these good clinical results with 1550 nanometer laser, and we can dermoscopically see that the ratio of anagen hairs are increased. But what is very interesting, what has not been published or which has not been showed before, is that you can see the increased pigments. So the whitish hairs are getting darker this way. Because my suggestion, my consideration is that of the WNT6 signals help restore not only the vellus shafts to get into the anagen shafts, but also helps to restore the melanocytes. I think that's why it works for the vitiligo as well. Macular amyloidosis, it's a very difficult to diagnose disorder. It's not very common in United States or UK, but it's common in Asian population and in Turkey as well. We can make a diagnosis, but it's very difficult. It's almost impossible to treat. But I just read a paper after confirmation of the diagnosis, histopathologically in this case, that 1550 nanometer may theoretically be used by extraction of the amyloid material from upper derms. So that's the results. And I think this is the first in the world that a treatment option helps for the macular amyloidosis, because it's a stressful issue. So you see these pigmented reticular patches, mainly located on the back and very itchy. So finally, this was a poor patient who had these lesions for 3 years without a specific diagnosis, because no colleague of mine took any biopsy. They just tried to freeze, they just tried to cauterize, but it was unsuccessful. What I did was the biopsy, and after the Grocott stain, we identified that it was a cutaneous histoplasmosis. So you can see these fungal microorganisms. So we started with oral antifungal treatments, itraconazole, then voriconazole. Just the lesions responded slightly, very slightly. Then we just consulted with the patient that we can give some intravenous sort of antifungal treatment, like you know, the systemic treatments, but the patient refused. Then we started the 1550 nanometer laser, because using these microthermal zones, we make a coagulation area, and I think this way the treatment helped for improvement of the lesion. The patient is still on treatment, and almost near complete resolution is seen. So we can treat we can use 1550 nanometer laser for difficult to treat skin infections, like the deep fungal infections, or sometimes atypical mycobacteria infection. And Swapnil, a friend of mine from India, just demonstrated the use of 1550 nanometer laser for atypical mycobacteria. So the indications will grow. The point is that, I repeat again, I used a nice CO2 laser, FDA approved, and a nice radiofrequency microneedle, but I never saw such an effect for the atrophic acne scars. And if you combine, so you can achieve better results with minimal side effects. So what happens after the 1550 nanometer laser is that the patients experience some redness. So it takes something like 3 days or 5 days to disappear, and rarely 7 days. But the downtime is much more lower than ablative fractional treatments like erbium, YAG, or CO2. The second is that you can see these black dots again, like in 577, but this will completely heal off. So how about the hyperpigmentation? Of course you can see it. And according to the literature, of course you can see the post-inflammatory hyperpigmentation. But the ratio is very low. It's very low in my personal experience, combined with the CO2 laser. Uppermost, this sort of pigmentation disappears in 1 or 2 months treatment. So what I suggest after the procedure, so it's not written in the maybe literature. But I advise to use topical azelaic acid cream just to prevent the hyperpigmentation. The other point is that you can see a slight tanning, but it completely dissolves. So as a dermatologist, as a doctor, we want to feel safe. And I see many patients just come for referral, previously treated with CO2 lasers and post-inflammatory hyperpigmentation. Previously treated with very nice radio frequency microneedling devices, the best ones, with very little progress. And you can give a gift this progress to your patients. And by the way, we have to use the cold air, like the Zimmer or other brands, during the procedure, because we make heat, and we have to cool down a little bit to avoid some side effects. So and to enhance the comfort of the patients. So we have to use the cold air together with the 1550, but with 577 never.
In 577, do you use a gel?
Yes, ultrasound gel without cooling. It's very important. Not
Another
cold.
question.
Of course.
Do you have any experience about keloid and citrate?
Yes, I just
citrate treatment.
Yes, very nice.
In combination treatment.
Yes.
Do you have an experience?
Yes, I treated patients with hypertrophic scars, keloids. You know, the hypertrophic scar and the keloids are not the same. If you take the biopsies, you see the keloidal eosinophilic glass sort of collagen, but not in hypertrophic scar. But, you know, the treatment is almost the same. And you know that in the histopathology, you see the dilated vessels as well. So that's why we have to use the vascular lasers. And the same applies for the stria as well. And according to my experience, it's not shown here maybe, but the keloid is very difficult to treat. But hypertrophic scars, very nice. And the stria distantia, very nice. I think there are some papers about the efficacy of 1550 nanometer laser for stria distantia. And in any indication for the pulse dye, you can use 577, any indication.